Okay, so you're Melissa Quam. I met you years ago when I was a psych nurse because I don't remember how I got your name, but I emailed you about learning about trauma focused CBT because I was blown away that there would be a treatment for trauma, or like how does it even go about treating that. And you met me not knowing who I was at your office to give me like an hour long lesson about what you do with trauma focused cognitive behavioral therapy. And so then I worked with you at Blue Stem for a while. Then you now work at Prairie Care. And so, but yeah, can you go through a little bit of your background? I know you have a bunch of training that
Sure.
I don't know all that. Thank you.
Yeah. So when I started working as like a little baby therapist, I started in residential care. So then I had just all these kids who had these really tough problems that I didn't understand and I didn't know what to do with. And so that's when I got trauma focused CBT trained. And that was like an initiative that the state was doing where they were training several cohorts. And so that was going to be like the model to treat trauma. And it is a very good model, I think. But what I was working with was kids who had multiple traumas over time. And so it didn't seem to capture all the things they needed it to give them the relief they needed. And so then I was in residential care for like 5 years or so, and then that crossed over with private practice. So I was at Blue Stem, I don't know, maybe 9 or 10 years, and now I've been at Prairie Care for a little over 3. And so at Prairie Care, I actually run a partial hospitalization program for kids who have significant mental health struggles. I teach DBT skills. So that was like the next, trauma based, like it was going to be the training. And I do think that DBT, dialectical behavior therapy, is super valuable. It helps, I think, probably all people. They should just teach it in school. But to learn the things they need to know to recognize what's going on, to regulate, to identify when they need to use some sort of skill or turn down their emotion on something. But so early on in my career, I got trained in trauma-focused CBT, and that was really useful to me because that understanding that this was trauma that I was seeing made it treatable now versus all these behaviors or things that didn't really make sense. And so I had that foundation early on, which was really nice because that drove me to always look for that first and to learn more information from that lens. But the particular information that you had listened to that kind of provoked this conversation came out of an additional training through ACE Interface. I don't know, I think maybe like 7 or 8 years ago, where they were working with the Olmsted County Bridge Collaborative to just try to spread this information, because if people can have access to information and education, then they might better understand what they're experiencing and maybe what to do with it. So that's where this conversation came from anyway.
Sure. And also I'm thinking about people listening to this, they might not know what trauma-focused cognitive behavioral therapy is, but it's a form of treatment. You have them write a script, right, about what their traumatic experience.
Yeah. So it has several parts. So the acronym that trauma-focused CBT uses is called practice. So the first part is to educate people, help you to understand what is trauma, what happens when you experience trauma, what are different types of trauma, those types of things. The second step is relaxation, because when you experience trauma, your entire nervous system is now kind of in this fight or flight response. So you have to learn how to regulate that through relaxation. Then affective expression is the A, and that stands for like emotional expression, because a lot of times people who experience trauma might misinterpret a facial cue. For instance, kids are really likely to misinterpret a flat facial expression as an anger facial cue, because from a survival standpoint, that makes sense, right? Like, I need to know if you're angry because my safety depends on it. But there is also a disconnect when you experience trauma I don't know how to explain it very well, but like sometimes the volume on your affect can get either turned way up or turned way down. So you might underreact to things or overreact to things.
The person who's experienced trauma, their affect or their facial expression can change as a result as well.
Right,
Yep.
right, yeah. And then cognitive coping, because a lot of times when we experience trauma, we start to view the world differently, view people differently. It changes your thinking. So helping people to recognize what are thought distortions, how do they change them, and then they get into writing their trauma narrative.
Okay.
So that piece has a lot of steps, but essentially the goal is to expose the kiddo to their story over and over again so they're desensitized to it, and then let them share it with somebody who they know is like just a really supportive other. So it could be a parent, but if they don't have an available parent, then maybe it's maybe older sibling or an auntie or an uncle, or sometimes it's just me. But
Okay. Yeah. Okay. I didn't remember that part of it, but you were saying something earlier about how, correct me if I'm wrong, but with that model, you focus on one particular big traumatic experience, and you were saying that you are with kids who have multiple traumas, and so then you got interested in dialectical behavioral therapy, or DBT. Is that, I get that right?
yeah,
Okay.
so TFCBT identifies what's called an anchor trauma, and that's what you write your narrative on, and that's what you do the work around. And the idea, I think, being a lot of times when you can deal with an anchor trauma, the most significant trauma the person is identifying, even if there are additional traumatic experiences, if you deal with the biggest one, then, those other
Sure.
things are kind of, I don't know how else to say it, but like cleaned up, those things don't affect you as much. But what I was finding was that, so I've almost always worked with like middle school, high school age kids. And so they would do TFCBT and they would present their narrative and they would do all this really hard work, but then they'd still have a lot of struggle. And I, wanted to help. So then I trained in DBT, dialectical behavior therapy, which is the like evidence-based practice for somebody who struggles with like suicidal ideation, self-injurious behavior. Essentially the only thing the criteria you have to meet to benefit from DBT or to be placed in a DBT program is to have had 2 or more types of intervention that were unsuccessful.
I did not know this.
Yeah.
I thought you could just go to DBT and...
Well, I mean, I'm not trying to be flippant, but most people have had 2 or more. So it's,
Yeah.
a lot of times I think the medical community thinks like, oh, DBT is like people who are really struggling need to be referred to DBT. But honestly, the criteria to be referred, medication and therapy that were unsuccessful, is 2 interventions. And it, we meet a lot of people who've
Absolutely.
had that, 1 or more therapists or a hospitalization. So it's, DBT was created for working with adults with borderline personality disorder. And so I can understand from the adult world perspective, maybe some of those, I don't know, those bigger thoughts, but like kids, any kid could benefit from DBT skills.
Oh yeah, I mean,
or parent, or
everybody.
Yeah,
As you said earlier, yeah, you said
right.
they're like,
yeah.
And so, is it fair to describe them as sort of their like life skills that they help improve one's mental health and deal with tolerating distress, and that's the idea.
Yeah, I think that's fair to say. I think the caveat is not everyone needs that much, right? So people who haven't experienced significant traumas in their life might not need that intensive of intervention or coaching or life skills. Although my bias is still like I teach them to my kids, and my kids are 4 and 7, So I think, and almost every time that I teach like a parenting class or do a presentation or talk to people that I know about it, they're like, why don't they teach these in school? These are, you should just teach them every couple of years.
This.
Yeah.
Yes, that's right.
So I understand that every, evidence-based practice needs parameters, and that's really valuable. And I still think that everybody could benefit from DBT skills,
And so you do that now. You teach these skills, and also you said something about intensive, because like true DBT includes, it's intensive in part because you have a weekly group, you have a weekly individual therapy, and then you do like homework in between, and that would be, and then it's like a year commitment, which is atypical from like traditional talk therapy. There's no commitment. You don't have to.
Yeah, right. You come as much as you want or don't. So if you're really going to participate in a DBT program as a kid, it's a 90-minute once a week group with a parent. There has to be an involved caregiver. So you and the caregiver are learning at the same time. There's 24-hour phone coaching too, because most of the individuals who benefit or need DBT maybe the most, I don't know, that's probably not the right way to say that, but they need the skills in the environment that they need to use them in. So learning them in my office and then coming back in a week for 1 hour isn't that valuable, but learning them and then being able to call your phone coach and say like, okay, I'm having a panic attack at school right now. What do I do? And then you get 2 or 3 minutes of coaching and you do the thing they told you, and then you go on with your day. Well, now you've generalized that skill to your life instead of just my office. So at Prairie Care, I don't do that model, but for people to know, if you were doing an outpatient model of DBT, it would be for kids or adolescents, it would be 90 minutes of group once a week with a caregiver, 1 hour of individual therapy once a week. You have to keep a daily diary card, which keeps track of symptoms and skills used. And then you have access to that 24-hour phone coaching if you choose to use it. Yeah.
Cool. Okay. So thanks for explaining that. And so, I originally wanted to interview you about ACEs because I saw a presentation you gave, and you're making me think of this part now that you had said at that time that, when you were a young therapist, the TFCBT was the cure-all, and then DBT, and then help me,
accelerated resolution therapy is the latest one that I have learned.
Accelerated resolution
ART,
therapy. Okay,
and it is. I don't know if I said this during the presentation that you were watching, but I'm like a fan of any gimmick. If it's energy work, if it's crystals, if it's massage, whatever. If it's going to help you, great. I love that. And so I had learned about accelerated resolution therapy from a colleague, and it just sounded like, magic. Like, no way. I've been doing this work for a really long time. No way this could actually work. So I took the training sort of prepared to prove it wrong, right? Like I was going in very skeptical, but hopeful that I was wrong and that it was going to work. And that has been just a mind-blowing type of intervention to learn, because people can come in the span of 1 hour and do an ART session and leave with that problem resolved. And so, and they don't have to tell me what they're working on if they don't want to. It's an internal process that they go through using, I have the script and I have all the steps and stuff, but they're doing the work. I'm just guiding them through the eye movements and the parts of their story. So, but it operates on all the tenets of exposure therapy. So all trauma treatments have a lot of things in common. Relaxation is one, right? Affective expression or regulation, looking at cognition, and seeing or speaking about whatever it was that happened to you, the exposure to the event. And so you pair these things together kind of over and over again, and you get desensitized to the issue. But ART does that with you in 60 to 90 minutes. So it's, and as the patient, because I've had to be the patient to learn how to do it, and also it's just really great. So sometimes I'm like, hey, does anybody have an hour? I want to do a session on something. But you can physically feel it changing your experience. And so I think that's just so beautiful for people to have that opportunity, because when you are steeped in your trauma and your trauma reactions, it feels terrible. So to come in and sit with somebody for an hour and be able to get rid of that feeling, that's freedom, So, so I can still do TFCBT. If somebody came in and they were really wanting that intervention, I could still do it, but I would try to do ART instead.
Sure.
So much faster protocol. You get relief. You don't have to say it over and over again to me or anybody else.
So we're going to get to ACEs, but again, part of this I think is interesting, and people would also be interested to know, okay, well, since we're talking about ART therapy or AR therapy, there are some, so first of all, that's individual. That's not a group thing.
Correct.
Right? And then, because I'm just thinking some people might be like, oh, what is that? How do I do that? And then also there's some exclusion criteria, like certain people should not engage in this, right?
Yeah, I think the only exclusion criteria, if I'm remembering correctly, so the inclusion criteria are you have to be able to move your eyes back and forth from side to side, and you have to be like sort of motivated. You don't even have to be like totally gung ho about it, but if you have like a seizure disorder or something, you want to make sure you get approval from your doctor before you do it. If you're experiencing psychosis, you wouldn't do it during active psychosis. You can't be under the influence when you do it. Those are the ones.
Are you, if you have a history of dissociating, is that, okay, so
No, I don't think that rules
okay.
you out, because dissociation is kind of part and parcel to trauma a lot of times.
Sure, and that's why I remembered it, because I was like, okay, that would be an important one, but that's good. That's not exclusion. Okay.
Yeah.
Okay, cool. So those are these are some treatments, and we'll move on to the main topic, which is the ACEs. So can you say what are ACEs and give a little bit of history as how this even came about to be a defined thing called, yeah.
Yeah, sure. So ACEs stands for Adverse Childhood Experiences, and how it came about is, I'm not probably going to get the year right, but in the 90s, there were a couple of doctors that ended up coming together. I'm not sure which one. So what I'm trying to remind my brain is, so Dr. Robert Anda and Dr. Vincent Felitti are the two doctors that ran the ACEs study. And one of them kind of stumbled across the data because he was working with people having gastric bypass, and they were having such positive results. And then they would come back for their 1 or 2 year follow-up, and they would have gained back all this weight, and he couldn't understand what was going on. And when he dug into it a little bit and started interviewing them, what he was finding was that they had experienced sexual abuse trauma in their childhoods. And so he was sort of, hypothesizing that these things might be related.
Good for that doctor.
Say that again.
Good for that doctor.
Yeah. And he had, so one of them was at the CDC, and then the other was at Kaiser Permanente in San Francisco. So they had access to, the study itself is like over 17,000 participants, but Kaiser Permanente is a large healthcare consortium. So these are middle class people who can afford insurance and have access to care. And so that's the other thing, people have sometimes thought well, that's just that population. But the ACEs have been able to be replicated so many times in so many different populations, whether it's underprivileged people or minority people or kids, adults, different, so the reality is that trauma doesn't really discriminate, unfortunately, or fortunately, I don't know. But so the study was about 17,000 participants. And then as they were kind of pulling out the data, the 10 ACEs that are measured in the study, and to have an ACE score, you just simply have to have experienced one thing before your 18th birthday. So frequency or intensity doesn't matter in terms of differences for the outcome. It related to this particular study. So neglect, like physical or emotional neglect, physical, sexual, or emotional abuse, a substance using caregiver, divorced parents, witnessing domestic violence, a mentally ill caregiver, or being exposed to criminal behavior in your home. Those are the 10 ACEs. And so if you said yes to any of those things, each yes is one ACE score of 10. And so he was able to, pull all this data and then start to see that ACEs in general are very interrelated. Typically, if you have one, you're more likely to have more than one. And as a result of, I don't want to say as a result of, but then in taking that data and comparing it to all sorts of different healthcare problems, there was a lot of indication that ACEs make these other things much more likely. And so if we can decrease the number of ACEs, ultimately we can improve health outcomes for people, period. is I think the idea.
And you would, since you're the expert on this, you would also know. Now, my recollection when I learned about ACEs, these adverse childhood experiences, and this idea that you have this score 1 through 10 or 0 through 10, and then it's predictive of the likelihood of having a physical health problem. And I remember learning that in whatever nursing school or graduate school and thinking, okay, well, that's interesting. But did the studies also talk about, like at the time, this also was related to mental health problems or other problems, or was it because I wasn't the best student, so I don't remember if it was just the physical stuff that the original study showed, or if it included all these other problems too?
No, I think it included a lot of other problems because it was able to be linked to like substance use, depression, anxiety, alcohol versus marijuana, so a lot of things that would be included in our mental health diagnoses, as well as, heart disease, diabetes, cancer, all these different things. So the original study was able to include all of it. And I guess it's been a long time since I've actually read the study, but in my interpretation, what I'm going to share anyway, is I think that's important to consider, that mental health and physical health aren't really not related, right?
That's
Like
right.
they're pieces of the same whole. And so we can't just like singularly treat one thing. And so I think that was another question. If I'm jumping ahead, you can pause me and rewind me. But another question that you had sent was, like how has this changed our treatment or healthcare, or has it? I think our medical folks are much better at asking the questions now.
That's good. They hear that.
Yeah.
Okay.
I think so. I mean, I think there's a lot of increased training. I've given this talk at some of our educational institutions around here for like NP students going into family med and things like that.
Good.
And one thing that's good is it wasn't the first time they were hearing it, so it was more part of their curriculum that way. So I think it's becoming more commonplace to ask about, which is really important. I think people previously just shied away from talking about traumatic things because they didn't want to be rude, or people didn't want to talk about it, or whatever. But also, if you don't ask those questions, you're ignoring a whole part of someone's lived experience that is really important, So I find myself about ready to go off on a tangent, so I'm gonna
Go for it. No, that's what I'm interested in. Yeah, go for it. What were you gonna say?
Well, I was just thinking about like when I first got TFCBT trained, for just as an example, I can still remember this kid, and she would be an adult now, certainly. But I came back from my training, and I was going to do TFCBT with her, and she had been in residential care like 3 or 4 different times, and she was like 12 years old when I met her. And I said something to her like, well, has anyone ever asked you about your trauma? And she was just a really funny kid. She was really tall. And so, here I am like 5'5", and she's like 6 foot. And she looks at me like, duh, no one's ever asked me. And I said, well, do you think that has something to do with what's going on in your life? And she was like, like, way to get the memo, professionals, And so I just started asking about it. And she was so ready to talk about it because she had been carrying this around with her. And no one asked. And if you don't ask about something that is so ingrained in my life, then that's, really invalidating to me. So, and as a kid, why would a child volunteer this information when they're with the professional doctor who knows all the questions to ask? It's not the child's job to know that this thing might have something to do with what's going on with me. And so I think, as a profession, we have gotten a lot better at asking. I don't know. It would be hard for me to say how much better we've gotten at what we do with the information, because this is what I do. So once I know the answer, then it's like, okay, we're going to treat this. We're going to deal with this. I don't know what, someone else who doesn't work directly with trauma all the time would say their, knowledge is about what to do next. But I think, at least in my role, as much as I'm able to through mentorship or supervision or just being on a team with colleagues, like anytime that a case is being presented, it's always like, okay, well, what's the trauma?
That's right.
So I guess that's how I can contribute. I don't know that it was an active part of my training program going through school or anything like that. I don't really remember that being.
One of the things you said, I'm going to just make sure this is still recording. Sorry, okay, good. So you brought up how, the mind and body are related. There's not really a real separation there, which I agree with. And I think that historically and even today, that's often not well understood or respected, especially within the physical medicine community. And so at least my perspective is I'm thinking a lot about people's primary care, and not getting asked these questions. Like certainly in psychology and psychiatry, we sure as hell should be asking them and know about their trauma history and that sort of thing. But I was sort of thinking, at least nationwide, you'll have, I meet patients who, they're getting medicated for something, or that's like, okay, well, yeah, this person has a history of trauma, or there's some mental illness that's being neglected, which is very strange. And so I'm glad to hear you say that you think we've gotten better about asking those questions, because I'm very dissatisfied with this being cared about. You also made a comment about, and I should add this too, and I will say in the mental health community as well, I'm very bothered by this, and I think that's often why medications can be prescribed when that's not the best way to go, is because even a psych med prescriber might overlook that, call the child's behavior something that it's not, and then medicate the child for it, and then go on their way. And that's another thing I liked about you when you were talking about the trauma-focused CBT, is that you're like, okay, well, this isn't addressing this other problem. And then you went about and you learned more, and you learned something that would address that, which is very good. And I think a lot of providers, whether they're medical or therapists or otherwise, sometimes they just keep pounding the freaking hammer, and they miss something so elementary as the trauma, which once again is why I'm doing this, is because it's like, I don't understand that.
Yeah. I think it's certainly not as simple. It'd be really nice to just be able to say, like, it's this field that doesn't know how to ask the question, or it's this practitioner, right? But I think it's just like ACEs, it's so common and so interconnected. Like, we're not learning about it in our educational programs when you're getting your master's degree or your doctorate. It isn't, there could be a whole course on ACEs just in and of themselves, and understanding how to do a thorough review and treatment of that, but there isn't, right? And on like a more like sort of legislative level, for people who are watching this or listening, Nadia Burke-Harris, who is
Surgeon General?
Is she Surgeon General in California right now?
I'm pretty sure, yeah.
So California and Minnesota often closely follow one another in terms of their legislative decisions. So she is doing a really great job right now trying to instill this from the top down and getting it into education and into healthcare and all those things. And I should say too, we have a lot of, and when TFCBT was first kind of coming to bear, like I said, it came to me out of a cohort from Minnesota DHS. So at our state level, they were seeking out the, most intensive providers and trying to make sure we were trained and understand it. But there's trauma-informed schools. There's a whole collaborative for that and educating people in school systems. So I think the stage that we're at right now is trying to educate systems, right? And then each person in that system kind of has the trickle down of how they want to apply the information. So, but that in and of itself is really inconsistent across the board, I think it has to do with where you work, who you work with, who your mentors are, who your team is, access to resources, time. I think our primary care professionals have 15 minutes for a visit that takes 45, you know? And so that's more of a managed care issue that's probably bigger than the scope of this interview. But
Yeah, well, to me, this is what I meant when I sent you a question about like it not being applied, and it is like legislative stuff or system stuff like the 15-minute visit, for example. So to me, that would be an example. You said something else too. So, okay, you brought up how, and you talk about it so patiently, because this stuff just burns me, like about, yeah, it's taught in schools, or it's taught to schools in some ways, but, and as you said, some people really, really, really get it inside of schools and some of them don't. And I hear from the parents that have the school staff that gets it and doesn't. So here's something. We both are aware of the stories where we'll take someone who, whatever professional they are, therapist, school staff, whatever, they might be aware of this thing, okay? And then they might be aware, yes, this adverse childhood experience will affect this child's problematic behavior, whatever the problematic behavior might be defined as, hitting or whatever, skipping class. Now, you said in some of your professional meetings regarding clients, you will be the one to say, okay, well, what's the trauma is the question you asked. So to help me know the difference between what goes on in your mind when you hear the answer to that question and what you do with it, compared to, say, a school staff, it's like, okay, well, their parents got divorced, like, and they think, okay, yeah, I should be more sensitive, or I get it, like, but this kid still doesn't have an excuse to be roaming the halls, or so, like, what do you do in that question, like, and also, why does it make any difference to know what it is compared to just, oh, they have an ACE score? Why do you need to know anymore?
so the question is, where's the trauma? So meaning, like, if someone's telling me about a student that's really having a hard time and they're like, I don't know, we've tried this intervention and this behavior plan and this and this and this and nothing works. It's like, well, where's the trauma? We must not know about it. Like maybe it hasn't been identified, because those interventions would work if this were simply a behavioral problem, or, depression. Okay, we're doing behavior activation. Anxiety. Okay, we're doing cognitive behavioral therapy. Like, if you're doing the evidence-based treatment for that particular problem and it's not getting better, then you probably don't have all the pieces, right? And the patience that I speak to it with is, I think, just a testament to time. And because the whole reason when I got TFCBT trained, I would read book after book. Like each week it was like, this kid has this problem. I don't know anything about it. I got to read this book. I got to figure it out, And so I think when you're a younger professional, you have time to do that, right? Because you don't have like kids yet or whatever. And so, so I had time that I could devote to that, but it just didn't, it wasn't it, And then I would get really, I think people come into these professions, right, because they're helpers and they're empaths and they're loving and kind. And I would get so sad that these kids had been through these experiences, and I would almost like overcompensate in trying to make things good for them, which also was not helpful, because people who have experienced trauma need consistency and predictability and, these types of things, which come out of being boundaried. And so devoting all this extra time, or not to say I wouldn't devote extra time, but, balancing between, are you working an 8 and 10 hour workday? Or are you working a 16-hour workday? How involved are you? Because then the other thing that I thought of while you were saying that, as I was kind of smiling, is I heard somewhere along the way that, like, at any point in their lives, 1 in 4 people meet criteria for PTSD at any point in your life. So that could be the same person meets it multiple times. That could be, it's a different one person every 4 people you walk by. It could be whatever. But just because someone might meet criteria for PTSD, someone may have experienced trauma and not meet criteria, right? So there are a lot of variables that go into it too. And our temperament is one, for in terms of, if you experience a traumatic event, how are you affected by it? People who tend to just be, they're just naturally more optimistic or positive, I think, have a different outcome about some of those things. What's your access to resources? What's your level of relationship with other people? And so as much as I'm going to go and advocate for whichever kiddo I'm taking care of, I also recognize that the people that I'm speaking to probably have trauma. And so as a system of human beings in the world, right, we're all going to fire off of different things about one another. So if all I can do is to just stay patient and regulated when I talk about it, now that's not to say I don't get fired up or, depending on kind of the level of information that whoever I'm speaking to either has or doesn't have. I might push harder or not, but me coming in and being like a bull in a china shop isn't going to change what this kid needs at school, right? If I'm not developing a relationship with their care team at school. So, I mean, yeah, do I get really frustrated? Sure, but it's not their fault either, right? Like they didn't hurt this kid. They don't know what they don't know. And so we're all just doing the best we can.
I'm absolutely 100% with you on that. And I do think about that, the logic of that, which is you're right. Then everybody I'm interacting with, the people that I get angry with, they did not choose their childhoods. And I very much respect that. And I don't have the self-regulation yet. I am the bull in the china shop. And so I respect that you do it because you're right. I mean, it's hard for me. And sometimes I'll try to justify it in my mind, which doesn't make logical sense, which is this. Like, for example, I've ranted on about insurance companies or the executives there. And even though I know those executives who would put profit over the health of children, okay, like to get another yacht or whatever, I know that executive has their trauma and I have compassion for that. And I know they didn't choose that. And sometimes I'll think to myself, well, but at some point it's certainly still not okay. I know you agree with that. The behavior is still not okay, despite what one has been through. You have to have a boundary there. But there's some part of me that my imperfect human part that's like, well, I'll allow myself to be the bull in the china shop with those people because I know they did it, but they're in a position of power and they're hurting multiple people. But I do agree with you, and I don't know. I think that more change might be had if I was more like you in this way, which is calm and respectful. And then sometimes I think, okay, there's a place for fiery passion in the bull in the china shop, if for nothing else to get people's attention, or maybe the executive in this fantasy of mine is only here, the bull in the china shop. But you said a very important point, which is that you're not just talking about our patients. You're talking about us providers. You're talking about the school staff. You're talking about yourself, your family. Everybody has their stuff and they came from somewhere. And so I'm so glad that not only you said that, but also that you do embody this in a way that I do not. You know what I mean? Yeah.
I don't know if that's entirely true. I think I was giggling as you were saying that about me being so calm. Because if you interviewed my colleagues, I don't know that they would all say that about me, or even my patients sometimes. I think that it is unfortunately a case by case basis a lot of times to decide how wound up to get about something. And when you're working with a family that has a lot of support or the parents are really competent and capable, I don't need to get as wound up because they are not as vulnerable because they have more ability to do some of these things themselves. If in residential care, for whatever reason, I seem to always have a caseload full of kids who were the ward of the state or a ward of the tribe, and they didn't have any adults. And then I would get really fired up. And so it became more of like a self-preservation. Like I couldn't continue to do the work and be that, dysregulated all the time. And also 10 years of DBT will help you think dialectically, right? So I think you're right. There is a time and a place for the bull in the china shop. And that's the same thing too with, in the ideal world, could we eradicate trauma and would that be so great? I don't really know if it would, because there are things that happen when people experience trauma that make them more fit for certain things they do, right? Like I would not be good at, like, oh, for instance, I would not be good at running a daycare with little kids, a whole bunch of them, at all. I can't. It's no. Like nothing about it sounds good to me. But hanging out with a whole bunch of teenagers, blast. I love it. And people who are really good with little kids and being really calm and nurturing and like they, do fun things and they rhyme and they're high energy and they're so wonderful. I don't have that. I also don't have the skills that are needed to go do like riot control. That would be, I would probably escalate things if I were there. And in the same way, some people who have experienced trauma maybe don't have the ability to sit one-on-one and have this conversation and sort of be put on the spot or have a lot of attention devoted to them because maybe their freeze response would come on. Mine doesn't. But if I'm around things that are really, really unjust, will I get really fired up? Absolutely. But I think, again, that goes back to temperament, gender, the family that you came from, the access to adult relationships that you had, what your life experience has been. I mean, there's so many variables involved in it, and the world needs all kinds. So I don't know that we could say like, oh, we need to completely eradicate trauma, period, because there are natural traumas that happen
Yes.
that we have no control over, right? And so someone who's maybe had more adverse childhood experiences is going to make a really great EMT or firefighter or emergency room nurse or doctor or, what have you, versus, well, I mean, maybe somebody who's experienced a lot of adverse childhood experiences is a really great preschool teacher too, because it's a high intensity, high energy, kind of high demand, right? Versus like, I don't know. I always hesitate to say the flip side because I don't want to offend anybody, but if I have a really alerted nervous system, I probably don't want to sit in the library all day and be the librarian in a really quiet space because that would probably make me really uneasy. Whereas other people might be like, that is my dream space. I want to go there for sure. So I think we need to just increase knowledge about it across the board, understand how trauma impacts the body, how it impacts the developing brain, and then treat it, right? But still, even with treatment, it's not necessarily going to completely remove the body's activation to stress or distress, right? What it's going to do is remove the kind of chronic daily impact that the trauma experience is having on the person. So I could treat somebody's trauma and they could still go back and be an amazing firefighter or EMT or whatever without kind of being reactivated every single time. Because that's really kind of detrimental too, right? That makes sense.
It does. I feel like for me, it seems that, well, I'll speak for myself. Like I certainly like those questions, like if you could change one thing about the world, what would it be? One of mine would definitely be like no more child abuse, period. And that's a certain type of trauma. So I've never really thought about what if there was no traumas ever. And I guess I have this picture for right now in my mind that the benefits that one could receive, and it's strange to think about benefits of a traumatic experience like that, and then also certainly the benefits of the treating that. I'm just going to pause for a moment because I just said something to my wife last night. I've had this thought for a year when I'm working in this field that like I think that people who have some really awful thing, whether it's trauma or adverse experience or adverse congenital anomaly, and they treat that thing or their mental space around that thing, that they are absolutely more strong than people who've never had to deal with that stuff to begin with. Like, like it's sort of different than, I don't think that pain and stuff necessarily makes you stronger. I think if you treat that, then that absolutely makes you stronger. So I do think there can be benefits from one's experience, even if they're awful. And I suspect that I have this sense that I think that those benefits, like we'll take you at the preschool example. I do believe that people can learn those helpful things. It's very difficult, and our culture's not set up for it. And I also think that I think it's true that if the world got better and better, there's always going to be problems, and there's always going to be things that like could be improved. And then the biggest thing in the world is now like, okay, the peanut butter jar is offensive looking or something like that. But I think the quality of life can improve. And so I think that about like, but I don't know. I've never really thought about that before. I've just thought, okay, like child abuse is so awful that like the I can't think of whatever benefits that it could produce that might not, that one couldn't teach in some future utopia or something like.
Sure, right.
Yeah.
Like the thing you're learning from having gone through that, we could teach you in a totally different way without you having to be harmed as a young person.
Yeah.
Yeah, I would say that the consequence of childhood trauma certainly outweighs like any benefit to it, right? And even just last week, I was talking with 3 different kids, and I said, we can treat this issue that you're sharing with me. We can treat that using an ART session. And they said, well, I don't know if I really want to give my trauma up. I don't know if I want to let that go. And this is maybe just a bit of semantics about how we think about it too, though, because I was trying to relate to them, you're not going to let it go. Your brain is going to remember your narrative. It's going to remember what your experience was. What you need to be able to do is not have your body continue to experience that all the time because you're not in threat all the time. So you're sitting in your English class in first hour and you can't pay attention because your whole nervous system is freaking out, right? And I think most people who've experienced adversity would say something like, it made me who I am, right? Now, I think that's also a case-by-case basis because I think some people say that as a way to just kind of make okay their daily experience, and maybe they haven't really yet dealt with it. And some people have their adversity has made them who they are, and they are more functional because they've dealt with it. But everybody has their own pace and story, and making someone deal with their trauma is just as traumatic as being, having experience in the first place. So giving people that opportunity to be aware of what are the available options, which they couldn't have if we didn't ask, right? So as a whole system of medical providers, we are doing better at asking. So now people have the ability to choose whether or not they want to treat it. My issue has always been...
Wait. I'm sorry. Say that one more time.
Oh, dear.
Ability to choose.
Because we are getting better as, whether it's an occupation or a field, at asking the questions, people are then becoming more aware of the option to treat the problem, right? Because before it was just something that happened to me. And like, well, this happens to everybody, or this happens all the time. People just get over it. And it becomes, in that narrative, it becomes like there is something wrong with me because I can't get over it. Versus now that more healthcare providers are asking you the questions, and we can talk about it from a space of like, it's not anything that's wrong with you as a human. This is the understood outcome of the experience. Like you're doing exactly what people do when they've experienced this problem. So then we can take away the shame, 1, and 2, then we can say, and those other people who've had this experience have found this intervention to be helpful if you want to try it. But it's your call, because trauma is a lot, you have no control when trauma happens. And so as a field, we can't force treatment on something either. That wouldn't be any better, but being just open to preventing or presenting the education and then the information so they can make a choice. I think even just the time and space to know they can make a choice, that somebody extended them that's reparative to someone who's lost, their power. So maybe that's why I'm more patient, maybe, is because I want people to have access to getting their power back, right? And if I'm a bull in a china shop, which, believe me, I've been that person. But all that does is take away their power to choose or communicate that, like, my power, like, I know better for them, kind of a thing, right? So instead of giving people access to their own faculties to heal themselves within a safe relationship where someone has the skills to help them do that. So I don't know. I think that helps me too sometimes to, like, even though I might have more urgency about, like, you could feel better. You could feel better. We could do this today and you could feel better. And they're like, no. And then every week they come in and things aren't better and they're in fact worse. And now they're failing school and this other horrible thing happened, or I'm using now, or I'm drinking. And it's like, stop doing all those things are trauma related. Can we just treat this problem? You know, is what I might think inside my body. And I mean, I'll communicate that in a different way to my patients and stuff. But again, all of those things are sort of predictable coping skills for untreated trauma too. So you're trying to help yourself. You're creating a bigger problem for you. So can we tap into that part of you that's ready to help yourself and maybe do it in a way that's more effective and isn't going to cause as much damage?
Yeah,
You know?
that's awesome. And I should say, certainly I feel that way with patients. I was thinking more that I'm the bull in the china shop. I think at times with people in a power position, which again, also I don't know that is always helpful. That's a question. But I do agree with you absolutely about not pushing treatment. And I'm also glad you said that, because I don't know about you, because your field is trauma. So when you see kids, it's about, but from, if you're not aware of this, from my office, there's very many kids who I know are afraid to go to see a trauma therapist because they think they're going to be forced to talk about the trauma. And they don't know, at least with what a competent, sane therapist would not do that. Can you say a little about that? Like, let's say you get a kid who's like 14, history of sexual abuse, and I say, I think it'd be good for you to meet this therapist, Melissa, and you happen to have an opening, and their parent really wants them to go, and I know that they're not going to, but what's that? Can you say a little about what that kid could expect from yourself or another well-trained, competent, therapist in terms of being forced to talk about their trauma?
Well, I would love to just say, I hope no one would ever force someone to talk about their trauma. And I know that's not true. Being a child and adolescent therapist is really dicey because your patient is the child, but the family is going to apply pressure, right? And sometimes as parents, we have a different priority than what our kid has because we know what's good for them. And well, I mean, I'm a parent. I certainly know what's good for my kids a lot of the time too. And the dialectical thought there is like, I don't know everything, so I want you to be able to deal with this trauma. And I know that the sooner you deal with it, closer to the traumatic event, the better the outcome, the better you'll feel, these types of things. And I don't live in your body. So I don't know what it's like for you to even have to think about re-experiencing this by working with someone. So I think as parents, it's really important that they are like understanding and patient with whatever their child's pace is, that they have a close working relationship with the therapist, and that child knows like whatever I talk to my therapist about is mine, and that therapist isn't going to talk to my parents without my knowledge, or say things that I don't want them to say. But I think as a therapist, sometimes it feels like, I don't know. I mean, I've had to like cut my teeth on this a lot, right? Like making sure that you are the child's advocate, period. Like you are on team kid all day long. And sometimes that means parents are mad at you or they don't think you're doing anything. You just talk when you come in here. You're not doing anything. Well, you could be right. Maybe we do just talk. I mean, when people ask me what I do at work, I'm like, I hang out. I hang out with kids all day. And when I tell kids like, I'm going to schedule them to see me at whatever time. I'll be like, what do you want to talk about when we hang out? Because the relationship is reparative. And I can talk to you about things that were really, really hard in your life because I also spend time talking to you about like what's for lunch today. And yeah, I hate mushrooms too. And, you know, here's this ridiculous joke. Like, people need relationships to heal. And so just because you're a professional and you might be an expert at a particular topic doesn't mean that you just push that topic.
No shit. I'm so glad you're saying this because that is absolutely true in the medical side. Like a lot of there are medical providers in this town, much smarter, more educated than I am. Fine. But sometimes I'll get people because they don't have the thing where where you can just treat somebody like a human being. I think that I call those providers like institutionalized. Like I think that they've changed. But I'm not just thinking about myself right now too. Okay, so I should make it clear, if there's a kid with trauma, you are always the one I want them to see. It's just very rare that because you're always full and you have this, you know, whatever. But that is like, if people could take something from this, you as this top trauma therapist saying that, yes, we'll hang out. That is what we do in there. And for that purpose, I think if people knew what I knew about you and your competence and your ability, that should be a huge lesson to them that's a big deal for you to say that. Like that catches my ears to hear you say that, because if you're saying it, then that means, okay, that's very serious. That relationship is reparative and hanging out is reparative. Because there is a lot of confusion about that. All the parents, they're understandably concerned sometimes, and they're understandably concerned. But I worry that there might be just misunderstanding with a therapist of, I asked them, they play games all day or something like this.
Yeah.
Yeah.
I mean, I think it can go both ways. Like, so if you have a trusted prescriber that you're working with, right? Like, so a family comes in, they're working with you and they really trust you and believe you. You have the relationship with therapists in town to kind of know who's good for certain things and who's maybe not so skilled at those. Because the relationship is reparative, and as a competent adult that they're engaging my services specifically for a certain thing, I can't just hang out, you know? And so, I mean, that might be the difference between, I say hang out, but we do accomplish a lot of things. But I mean, I'll put my feet up on the desk and I'll sit on the floor and we'll color and we'll, you know, I mean, half the time I'm not sure I'm much more grown up than the kids that I'm working with. But I also think that's why it works, right? They also know that if I need to say something to them, they're going to hear about it. You know, if they're doing something that's not above board, I'm not going to just say nothing, but I'm going to say something in a compassionate way within the context of our relationship and trust their judgment, you know? So that kind of comes from that DBT model. And I'll do this with my own kids. I do this with the kids I work with, you know, if they're making a decision that I, as an adult, am worried is not going to have a good outcome, I will say, you know, I think if you continue to do this, then maybe X, Y, and Z is going to happen. And I trust you to make a good decision because that's where I'm using a relationship. Depending on how you lay that on, though, it could be very shaming. And so you have to, again, there's so much to relationship, whether it's therapeutic or just human, right? I mean, think about the people you interact with on a daily basis, not work related. I'm not going to call up somebody in my social life to tell them about the hardest thing I just went through when that person always has an agenda every time we talk. That's not the person I'm calling. And so for parents, you know, we get scared. We love our kids so much that we are so scared that whatever they're doing is going to result in some horrible thing because that's what parents do. I think that's part of like the minute you get, you know, start a family, it's like you start having all these fears you like never even thought of before, you know? I mean, I would like stand there and watch my son breathe, you know, and I knew in my head, like, this is nuts. What are you doing? But I'd be like, I can't go to bed. I can't go to bed because what if he stops breathing while I'm gone? You know, like these are the things we think about all the time. And so I think honoring that fear in yourself and having the skills to keep yourself regulated, because relationship is reparative. Who do your children have a relationship with if not you? So if you are not regulated when they come home from school, when they come out of therapy, whatever, when they do the really awful thing that you wish they would quit doing, if they walk in the door and you're screaming immediately, that's not the environment they're going to get better in, because they're not going to come to you anymore.
Yes.
And so is it like an act of God to keep your mouth shut sometimes? Absolutely. Do you want to just rip your hair out? Yes. And that's why you need a really good working relationship with the therapist, or have your own, you know, or have a really great network of other parents who get it. But I mean, even in our house, I can't tell you the number of times in a day where like I'll like look at my husband, or sometimes I'll even text him like, they're driving me nuts. You know, I am going to lose my mind. And he'll be like, yeah, why don't you go get, you know, groceries or run to the store? And I'm like, yep, you're right. Because it's too loud in here. I can't, you know. And there are days when he needs that. And so, you know, kind of going back to the utopian world where we just don't have trauma. Even if you didn't have trauma, you'd still have these different personalities, right? And these different levels of distress and escalation and agitation. And so all of us have a responsibility to navigate those things in an effective way.
Yes.
So,
and part of the utopia that I envision includes education like this. And when you think about that parent that we both have so much compassion for, that I will be someday, in terms of, you know, fortunately, because of the age of my kids, they're not able to go out and do much, but like whatever it might be, they might get into drugs or these things that could be very concerning to me. As you said, it's sort of taking an act of God to not blow up would be one example.
Yeah.
And because of what you just said, that would be the not blowing up, or its equivalent would be the therapeutic thing to do that would be more likely to help that your own child in that case. I think it's the lack of education in our society that doesn't help parents know how to not blow up, and I care about that, and so I'm hoping that people can just even have the vocabulary, like the things we're talking about today. Emotional regulation is a word, or these sorts of things, because of course any parent is going to, any sane parent in our current time in history in this country is going to say, well, how the hell do you not? Or with me, when I asked you, and I said, oh, like I'm this stuff burns me, and I would argue with my own being compassionate towards myself. It's like, okay, well, I didn't learn, like I went to school like everybody else. Like, you don't learn this stuff, and that's that. Yeah.
My family was all, you know, it's deer hunting opener or whatever, so they're hunters. I just go along to sit around and do nothing. But everybody was, you know, at the cabin this weekend, and my sister-in-law and I had driven together. And we were having this conversation the whole time of like, you know, we're all a product of the family we come from. Whether that's an intact family that sat down and ate dinner at 5:00 every night or not, you know, whatever you came from is what you know how to do. And none of us went through grade school, our parents included, being taught like, well, if you do this in front of your child, then they're going to do this. I would argue that at most, my generation and those before me, it was like, do as I say, not as I do, right? And so this mantra kept getting repeated for years, although it's not effective. Like, you keep saying these things, but no one does that. I'm going to do what you do, not what you said. Or if I'm going to comply and only do as you say and not as you do, it's because I'm afraid of you, which is a different thing, right? I guess that's a little dramatic. It could be the total flip side. If I'm going to do what you say and not what you're doing, it's because I trust you so much to guide me. That could be maybe another side of that coin. But so as she and I were talking about it, I was telling her about some times when my son was really little, when I only had one kid. And I've told you some of these stories before too. I was super dysregulated, like all the time. I mean, I wasn't sleeping because I was watching him breathe, you know. And then it occurred to me, one day I know I scared him. So that was a big deal to me because I got mad and I yelled and I could tell it scared him. And as a parent, that like broke my heart because I didn't want to raise like another generation of kids who are just controlled by anger, right? So that was one thing. And the other thing was, and this is like a little bit stupid, but maybe it'll work for parents because it helps me every day. I got so sick of getting out of the house by the time I got everybody in the car and buckled and snacks and whatever, and I was raging. And then I dropped the kids off. I mean, I wouldn't be raging out loud, but like in my body, like, oh my gosh, they can't get out the door, you know? And then I dropped them off, and like the rest of my morning was shot because I was so like emotionally agitated over this daily fight, right? So then I was just kind of like, I don't want to feel like that anymore. This is terrible. I'm not doing it. And ultimately, the only thing I had control over in that moment was like how I'm going to interact with these two kids every morning. And so I can yell and scream, but that's not working. And I look ridiculous, and then they act ridiculous. And, you know, my self-preservation is I like to believe I'm fairly intelligent, and I really don't like to look stupid. So I was not, you know, meeting those benchmarks at home. So, okay, what can I do to change this? And in the moment, it really does feel like, but I really just want to blow up right now. I just want to like throw a fit or yell or whatever. That's what I want to do. And it really feels unbearable for that 30 seconds or 5 minutes to not do it. But if you get through that and you drop the kids off or whatever, and then you're going the rest of the morning and you're like, I'm feeling good. I'm feeling much better. And we actually did get out of the house without much conflict. It's reinforcing, right? Like I'm going to keep doing that. And my kids, my son is 7, and he's funny. He's naughty, but he's funny. And I was really naughty. So I like most of the time when he does the things he does, I'm just like, oh man, okay, all right. I see what's going on here. Oh, geez, you know. But one night we were like laying in bed doing bedtime stories and stuff, and he was just ripping on me, just giving me such a hard time. And I was laughing. And I said to him, like, buddy, I'm laughing because I have a sense of humor like you do, and I think this is funny, and I need you to know, you know, and I was about to give him the whole lecture about how you don't talk to adults like this and whatever, and he's like, I know, I can't go to all these places, and he said, and I can't talk to Dad like that. And then I started to laugh even harder because I was like, well, why can you talk to me like this and you can't talk to your dad, you know, like this? But as families often do, his dad has so many complementary characteristics to mine that the things that don't bother me at all drive him nuts and vice versa. And so the things that my son does that I think are kind of funny and like a little bit charming for like, you know, Dennis the Menace or like whoever was the kid in Problem Child, that's kind of more my son. My husband does not think are charming and funny at all because he did not do any of those things. That was not in his house. You did not do those things. And in my house, we did a lot of it, right? So you're a product of what you come from, whether you choose to pass it back or pass it on. But you have to have your own personal awareness of what it is you come from, how you might be playing it out on any given day, and whether or not you want to be, you know, like, are these redeemable things that you learned from your family or things you would rather not pass on? So you have to be mindfully aware, right? So that's the DBT lingo, is mindful. So that means I have to pay attention to myself all day long, which feels as a parent very selfish. I don't have time to focus on myself. I have these kids to raise. If you don't, everything else it doesn't matter.
Can you explain what you mean by that, by pay attention to yourself?
So, like, I have to know the words I'm using. I have to take the accountability for now, this is not to say for everyone listening and watching, like, I am not the, like, paragon of parenting. You know, I do things in front of my kids all the time that maybe other people would think you shouldn't do, right? And also, when I do those things, I'm willing to take accountability that I just did them. I'm going to own whatever came out of it. You know, I'm going to try to use it as some sort of teachable moment. Or if my kid does it 20 minutes later, I'm not going to yell at them because I just did that, right? So I'm mindfully aware of those things, how what I'm doing or saying is being observed by the people in my life. I'm very aware of, like, internally how I'm feeling most of the time. So this is something I think that as a culture, we just don't do. And so we just go. We check the boxes. We get the things done. We next, right? But each one of those things, and this kind of goes back to whether it's trauma or just your nervous system in general, if you're wearing a smartwatch and it's zapping you all day long, like that's alerting your nervous system. You're getting a chime on your phone, you're getting a chime on your email, you're getting a pop-up, then you've got a kid talking to you. All these things alert your nervous system. So all day long, your internal system is like, ooh, 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 right? So it's the equivalent of like trying to get something done when people keep interrupting your stream of thought, which is not effective, right? So if we don't stop to pay attention to what's the impact of all those interruptions having on me, then we just blow up, or we shut down, or we go to bed early, or we overeat, or we drink, or we smoke, or we do all these things to try to cope with that internal dysregulation. So by me increasing my own awareness of it, I can show up and be a more effective parent, but also I can teach my kids to be aware of what their internal system is telling them. And then we manage our house different too, like if it's too loud, or I can't stand it when I come home and they're all sitting at the dinner table and the TV's on, drives me nuts. Because like
Why is it on? Yeah.
First of all, why is it on? And not that we even eat together like that often, but if we do, why is the TV on? We can have a conversation for like all of 10 minutes that you're going to be eating your chicken nuggets for like the fourth time this week, But I don't think that we're taught that all of those environmental stimuli that are going on all day in a normal environment, they're agitating. The bell at school, the kids talking, the constant Snapchat, the constant Instagram, like all of those things. And if you don't take time to just like shut that off or let it go, or just acknowledge that it's there, then you just blow up or shut down or retreat, so you're not present anyway. If that makes sense. That was a little bit tangential, but I feel pretty strongly about that.
Right on topic. Well, the other thing too I'm thinking is that I could also imagine parents listening to this, and I think that there's a big difference between understanding the concept of what you just said. Yeah, there's always buzzers and stuff like this, but then actually really viscerally feeling it. And I could also imagine parents thinking, well, how the hell do I do these things? And I think that would be the work of therapy, is that these things, and another thing our culture does that I just love is this, people are taught to beat up on yourself because it should be so simple to do these things, which is to say, take your breaks from your cell phone or whatever, and I can't do it, and I just need to pull myself up by my bootstraps, and this should be so simple. But I think that's, to me, this is like one of the core things I get out of therapy anyway, which is like those things that like our culture says are so easy that you should just be able to do, that are incredibly difficult when you're paying attention and you care about doing them. To me, that is something I get out of therapy, is like, is okay, how do you go about then doing that thing, the self-regulation? Or, okay, well, I have all of this crap in my week, so how do I take my break from my smartwatch or whatever it is? Yeah.
I'm finding myself having like a visceral response. So this goes back to why the relationship matters, right? So again, how I communicate with people matters, because if I go to someone and they say like, well, you should practice mindfulness, how do I know that person is going to change whether or not I'm even willing to do it? But also how that information gets delivered, like, well, you need to just make time for this, versus like, it's really important and it's really valuable for you to set aside time. How can I help? Those are different things, right? And really being able to step back with, whether if you're a single parent and you don't have the spouse, then find a close friend to like kick this around with, or journal it through, or if you go to therapy, talk to your therapist about it. If you're in a relationship, then having that conversation with your significant other about what are our priorities, because, and if you're like a factual based person versus a feelings based person, there's a ton of research on this, that people are not actually multitasking. You're just switching between multiple tasks, in split second increments. So we're not productive anyway, which is why you feel terrible, is because you didn't get anything done all day. But if you're really carving out that time to pay attention to what's going on internally and shut off things. Oh, this is where I was going with that. So depending on my relationship with people, if someone says to me like, well, when I was your age, blah, 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 right? Like usually anything that's followed by that, I'm immediately annoyed and I don't want to listen to you because I feel like you're just invalidating whatever thing I'm about to, talk to you about. And that's hurtful, right? Mm-hmm. But if I myself, or if that person is not delivering the information in that way, if I'm able to step back and think, 20 years ago, they didn't have this and the world worked, not in like a smarty pants kind of a way, but people have been doing this for hundreds of years and they didn't have to do it the way we're doing it. So
which thing is that? I'm sorry.
Well, whatever it is, communicating with one another, spending time together, there, prior to the COVID pandemic, there was, I think, a pretty well framed, 8 to 5 work day. People weren't readily accessible all the time. Right. And so again, and this goes back to like, what are we teaching our kids? If you're available 24/7, then you're not teaching yourself that you're valuable, that your time is meaningful, and that it's important to step back and unwind and be present with people. So I have a lot of feelings about that, I guess. But a way that I can kind of practice these things in my own life is in not pull yourself up by your bootstraps kind of. I think you just have to find people that are willing to leave that mentality because it's so ingrained. So you almost have to, what's the word I want? Immerse yourself around people who are willing, even if they're just saying the words, like just starting to hear the message that, nope, that was a really terrible thing that happened. And you don't just have to pick yourself up by your bootstraps or, nope, that message isn't okay. This is more realistic, which is what we do with kids when they come in for therapy, right? Because trauma causes you to develop those kinds of cognitions. I should get over this. I should be able to just pick myself up, brush myself off, so that makes it something is wrong with me. I can't do this. But the reality is like, no, you shouldn't. I don't know, that message came around a long time ago. It wasn't functional then. It's not functional now. And at the end of the day, like, is that working for you? Is that way of talking to yourself effective? And if it's not, then let's change it. If you can genuinely say to me like, Melissa, it works. And like, I don't really feel that terrible and I get my stuff done and it's pretty effective. Okay. Well, if you want to keep using it and you think it works for you, then great. But in your like heart of hearts, when you check in with yourself, is that working? Just like my, yelling at the kids to get out the door. This is not working. So what do I have control over? How I decide to interact with them every morning, how I decide to set things up so we can get out the door, What works in one family doesn't always work the same in the other. But I do think that letting go of the shoulds it's really liberating. And quite frankly, most of the ones we believe aren't accurate anyway. Like nobody actually cares what kind of car you drive or if your shoes are name brand or whatever. And if they do, then those probably aren't your people anyway. So it's not necessarily related to trauma, but the reparative relationship piece is you have to find people to be with that are going to be championing the information you need to hear. Or shut off the TV if it's sharing with you things that are not serving you, You don't have to take all of that in. You could read a newspaper and you could, take it in yourself, but not hear and see the messaging in the same way. So, sorry, tangent.
That's great. I know actually like there's so many things to talk about. And I also want to be respectful of your time as well. But I'm thinking, I'm thinking about, cause like, I hope you do this again.
Sure.
Oh, good. Thank you so much. There is so much stuff to talk about. This is wonderful. And I know it's like such a huge service to people. Like I know people will like this, but I do want to just do, one more, brief round with the ACEs because, so I think that at least to me, what's important that people know is just that they exist. This is this thing called adverse childhood experiences, that there's this study done, and that and the way they measured it is that the more of them you have, not necessarily how often did they happen, but if you have more of them, you're more likely to have negative health outcomes, be they negative mental health outcomes, like higher likelihood for depression or substance abuse, for example, but also like problems that we tend to think of as physical, such as higher blood pressure, increased risk of diabetes, this sort of thing. The relationship between, acknowledging that, okay, clearly these experiences put one at much higher risk of these negative health outcomes, but also people in the child or adult's life that are aware of this, sort of having a respect for, if someone's been through some stuff, they're very likely to have certain issues, and it doesn't mean that they can't overcome them, but to expect them to somehow be different or not have these things, or to be disappointed or express judgment towards them should they have them, is a real big mistake to make. Yeah. Are there other things that you think like would be useful to re-emphasize? I mean, there's a lot, but like anything.
Yeah, there's so many. But the last thing that you said about like understanding that these people, had these experiences and they're not just going to get rid of or be over the impact of the experience. I think the other thing to, I don't know, just walk around as a community member or a human being or a parent, is that we also don't necessarily get to choose what the aftermath of experiencing trauma is, And so as people, it's whatever, like better if you're likable and quiet and agreeable and these things, it makes you like an easier person to be in relationship with, right? If you've experienced trauma, you might be really prickly and mean and short with people and hot-tempered. And so as like a fellow human, when you encounter those people or your kids are being that way, be thoughtful in how you interpret that person, how you respond to them, how you see them, because we're all born inherently good. We all want to do well. No one wakes up in the morning and thinks like, I'm going to have so much fun pissing people off today. No one does that. We all want to be successful in some way. And so if people are being difficult, they probably also feel really terrible. And so not that that's always our problem to solve, but I think it's just helpful to keep in mind that sometimes that can be the outcome of trauma too.
Yeah.
Yeah.
Thank you. Thanks a lot for doing this.
Yeah.
I appreciate it. Yeah. Melissa Quam.
Oh, yeah.